Hello and welcome to Economic Forum. My name is Tawanda Goodlanga. The world has faced its worst global pandemic yet, and so far up to 18 million people have been infected by the deadly COVID-19. Zimbabwe has declared a national disaster on COVID-19. In the studio, we have invited Mr. SIRAKI. He is the United Nations Communications Specialist, as we seek to understand how the family of nations is working towards salvaging what is left of the pandemic. And in this new normal, what can be done, if at all, the SDG agenda is to be realized. Sir, thank you so much for coming to the program.
Thank you, Tawanda, for having me on Economic Forum. Glad to be here.
COVID-19, no doubt, has torn the world apart. And obviously, this has had an impact to the economic policies, social policies of member states. From the UN, what has it been like? And are we going to find ourselves out of the woods?
Indeed, we will find ourselves out of the wood. But as you rightly said, I don't know if I can call it a new normal, but we are on a new territory, quite very new. And the world is fighting the pandemic, all hands on deck, including in Zimbabwe, in Africa, globally. And the way we know life in general has been completely affected. And we have the resources, the tools, the know-how, the technology, scientific analysis of the whole pandemic really focus on prevention. And there are tried and tested prevention measures based on evidence that people have to keep washing their hands, need to maintain 1 meter distance, and need to apply as well appropriate wearing of mask. And at the same time, if it's not necessarily to stay at home. These are the prevention measures that the science knows as we speak. And if they are applied, we can break the chain of this pandemic. On the other side, there are rigorous investments and breakthroughs that are being made and tested in terms of finding a vaccine and eventually a cure. We don't have one, but there are quite a number of experiments that are showing promise. So this is where we will defeat the pandemic. But at the same time, on the economic and social sphere of where the pandemic is wreaking havoc, we need to think in a different way. We can't go back to the way we used to do business. And I think the roadmap we have is the Agenda 2030 for Sustainable Development and the 17 goals. They are interlinked. Of course, we were still off track in quite a number of the goals of ending poverty, of ending hunger. But what we can draw a lesson from COVID-19 is, first and foremost, we are all interlinked globally. We are a global community that we should marshal our resources in a sustainable manner. And we cannot as well spare and play dice with our planet. Pandemic, some of the studies that are emerging are, unless we strike a proper balance of maintaining our wildlife, of reducing wildfires, of maintaining in general the ecosystem that we know, it will be very difficult to make a breakthrough. So the Sustainable Development Agenda gives us the blueprint of balancing our economic breakthrough in terms of gaining prosperity, in terms of reducing the inequality that we see in the world, across countries, between countries, within countries, and then maintaining as well the ecological balance. If we do this, all the 17 goals and the 169 targets that have been endorsed by all member states, including Zimbabwe, I think we have a great chance of bouncing back better and then building back a sustainable society that we can all live in harmony with our planet.
But can we agree that the philosophy and ethos around targets at a global level, Millennium Development Goals, which then influenced the Sustainable Development Goals were really born out of more of political, economic frameworking as opposed to actual livelihoods, health, looking at the way that probably the world was hit by the COVID-19 pandemic.
The difference between the Millennium Development Goals and then the 2030 Agenda for Sustainable Development is, first, the world has learned a lesson from the experiment of the Millennium Development Goals. What has given birth to the Millennium Development Goals is the Millennium Declaration, as you rightly said, a political declaration of all member states as well, agreed at the dawn of the millennium in 2000, September 2000, this General Assembly Summit. They said it's unacceptable to see in this planet of plenty, be it in science, be it in technology, be it in financial, be it in material, be it in knowledge resources. It's unacceptable to see poverty, to witness hunger, to see quite a number of our children left behind from completing their primary school, let alone to go and achieve their aspiration in life. So to see and witness a rampant maternal mortality rate, death of children below 5, the HIV and AIDS pandemic, by the way, I call it pandemic, it was a pandemic at that time, and of course the environmental sustainability, because the issues were emerging from this. So member states agreed that these are the issues that we need to tackle. So the declaration is very bold and very ambitious. Then a high-level panel of experts came up and tried to make sense of the declaration, where they then said, well, the big chunk of this challenge are in developing countries. So if we help developing countries through committing particularly the advanced economies of their GDP of 0.7% and assist developing world to address and reduce poverty by half, if they can enroll all primary school going children to school, if they do some 50-50 representation in their parliament, in their councils, in other elected and non-elected positions, if we can halt and reverse the pandemic of HIV and AIDS, and if we could do as well, it was premised on provision of clean and safe water, where we talk under environmental sustainability, then we can assist the developing world to catch up. So that was the premise.
And we'll catch up on that in the second segment as we seek to understand that shift from the political discourse into the actual social economic prosperity through the goals. Join us then. Welcome back. We are focusing on COVID-19 and its impact to the globe, particularly in Africa and in Zimbabwe. And we have in the studio Mr. SIRAKI, the United Nations communications specialist. Now, you were talking about those aspirations, making sense of the ambitious targets, which then translate into the sustainable development goals. Now, interestingly, Zimbabwe has Vision 2030. Which has common grounding with Agenda 2030, which deals with some of these challenges that they are supposed to be met. But what then becomes the role of the United Nations in working with member states? Because there's always been that feeling that the United Nations has a certain leaning towards certain member states over the other.
Yeah, when we come to the 2030 Agenda for Sustainable Development, the UN had a convening and facilitator role as the Secretariat and the overseer of global development premised in this charter which is turning 75, by the way, this year in October. So based on that, the UN had only a platform that brought on board all the member states. And when, from the get-go, there was an intensive consultation under post-2015, because the Millennium Development Goals came to an end in 2015. So the world went into the drawing board. They drew lessons from MDGs, and then one of the lessons were there should be an inclusive participation, not only at member states level, but all segments of society must participate to define the world they want. So individuals were allowed to go online and vote for the goals they want to see their countries and the global community address. So in Zimbabwe, we had around 20,000, if I refer the consultation, quite 20,000 Zimbabweans gave their voices on how they want to see the world. Of course, there are as well organized civic groups, civil societies, churches. They put as well their position paper. And then Zimbabwe was one of the 5 African countries who were commissioned to join the open working group who were dealing the technical side of it. From SADC region, it was Zambia and Zimbabwe. My point is, there was no leniency to one or the other. The whole arrangement was done in a thorough consultation. And of course, one of the major lessons is we have to be ambitious. We can't talk about reducing this, reducing that, and talking about average. We need to end, the bedrock of the whole SDG system is we need to end poverty in all its forms and manifestations by 2030. We need to end hunger. We need to ensure that there is quality education. We need to ensure that all people have access to quality universal coverage of health. We need to ensure gender equality. Before it was like, in terms of percentage, from a given baseline, you need to increase by 35%, by this percent, but now it's 50-50 by 2030. And of course, the climate side of it, 3 or 4 areas that talk about climate issues, climate related, responsible consumption and production, SDG 12, SDG 13 on climate action that led to the Paris Climate Agreement. And of course, to do this, there was an Addis Ababa Action Agenda for Development Financing.
Yes.
In that, they agreed as well, governments are responsible to raise domestic financing for these SDGs. That doesn't discount global cooperation in terms of multilateral and bilateral collaboration to make it happen.
Which poses a
that
challenge.
Doesn't discount as well
sir.
the contribution of private sector to be part and parcel of this whole process. The other side is, as and when we slide into humanitarian crisis, as Zimbabwe was hit by drought, by Cyclone Idai, the Sendai framework puts 10 principles or 10 action agenda where member states, multilateral through the UN, bilateral, can come in to support, while countries still sit at the driving seat to make sure that they have risk reduction capacity in place, resilience processes and capacity.
Posing a huge challenge to countries that are like Zimbabwe, which have been affected by natural disasters, and then you have the COVID-19 coming in, and yet you are expecting, or the expectation is that the member states should be financing the SDG agenda to eliminate the poverty that you talk about and also deal with climate issues. Yet the focus now is on COVID, and all resources seemingly are going towards the COVID issues. In Zimbabwe, the challenges are that those that are on the front line, for example, in the health sector, have been calling for more allowances, risk allowances. Also, the protective wear has to be procured, and that obviously has an impact to the national purse. How then do member states such as Zimbabwe then handle the case where they have to balance the needs of the Sustainable Development Goals as well as what is currently considered as a wartime scenario.
Indeed, nobody foreseen COVID-19 when all this thing was arranged. In fact, at the beginning of the year, while this story of COVID-19 used to be called coronavirus or SARS-2, when it reared its head in Wuhan, China, nobody anticipated it would blow to this magnitude and intensity. So there was a commitment from the UN side, a decade of action. How can we reinvigorate the whole, agenda? Because we had 5 years from 2016 to 2020. The lessons that have been drawn from this show that with the pace, the vigor, and the investment that has been made, it was unlikely to achieve this poverty. We need to recalibrate our efforts. Member states, the same, endorsed the whole decade of action, including Zimbabwe. If you recall, the head of state, His Excellency, stated before the pandemic in his State of the Nation, decade of action in sync with the Vision 2030 to be upper middle income country. So the ambition, the vigor, and everything was there, but we were hit by COVID-19, and as you rightly said, resources had to re-marshal to address COVID-19. But what we are saying as well is, of course, all decks on hand, all hands on deck to counter this COVID-19, but we do have a blueprint and a roadmap, and nobody is idly sitting only tackling COVID-19, including the government allocated 18 billion Zimbabwean dollars to address the COVID-19 issues, including its economic and social aspect of it. The United Nations had, with partners, appealed for $800 million to respond the health component and then the humanitarian side of COVID, including in response to the drought and some of the residual impact of
Let's talk about the
Cyclone
800.
Idai.
Let's talk about the 800 million.
This is over
after
in
the break.
yeah.
Join us after the break as we seek to understand the global package to assist countries such as Zimbabwe. Join us then. Welcome back to the third and final segment of Economic Forum, where we are focusing on the COVID-19 pandemic and understanding what the family of nations led by the United Nations are doing to help member states such as Zimbabwe. I have Mr. SIRAKI, the United Nations communication specialist. You are talking about the packages, the Zimbabwe government doing its part, $18 billion package. You are talking of an 800 million United States dollar package. Tell us more about the package and what it has done for countries such as Zimbabwe.
The 800 million, you're calling it package, it was an appeal, humanitarian response appeal. 715 million of it was to support communities affected by drought, economic challenge, and then part of the cyclone. As we speak, people are still living in tents and they are dependent on humanitarian relief assistance while the recovery program is underway. The 75 million of the 800 million is earmarked for the health component of COVID-19 to assist with procurement of PPE, to strengthen the health system in terms of infection and disease control, or tracing and expanding the services, particularly in testing, tracing, and isolation and quarantine. So far of this 800 million, 18% has been received by a number of those actors on the ground, which is equivalent to $145 million. And 64% goes to food assistance. People need to eat while the whole... This is purely from the humanitarian response. On the other side, a number of our agencies like UNDP and others had to redirect their development programs, as we were speaking earlier, in terms of government and others redirecting their program to respond to COVID-19. The Global Fund that's managed by UNDP, around 4.1 million immediately was redirected to procure PPEs and assist the health workers in terms of having the proper gears. UNICEF does the same in terms of providing water tracking together with Oxfam. So it might not be enough, but they've been doing it since March in terms of providing water tracking to those communities, particularly in suburbs and the townships in Harare and other parts of the country that really require water supply. Is it enough? I doubt if it's enough, because the response as we speak stands at 18%. But going forward, resource permitting, the UN does, together with government and other partners, an assessment within ZIMVAC and outside ZIMVAC that's led by the Food and Nutrition Council that resides under the OPC. So all partners do make needs assessment, and all this response plan is based on that assessment, where the UN says, okay, out of this national requirement, what can we marshal in terms of mobilizing resource? But it's sectoral. There is food assistance, there is water and sanitation, there is education component, as we speak, quite a number of students. At home, how do we provide, at least reduce the interruption of education? And as you may recall, we are providing through UNICEF and radio programs, people are getting educated, those who are off the grid, and those who are on grid, we are sending online courses. So this needs to be harmonized by the Ministry of Education, but these are the areas that the UN is. Nutrition is one of the biggest components. If we cannot address the nutrition needs of expecting mothers, lactating mothers, and children, it will be very difficult to have the Zimbabwe we want in the future. There is a protection component of it. We talk about increasing gender-based violence because of this lockdown. There are services that our partners like Musasa Project are providing. There is a 24/7 hotline where people who are affected by sexual and gender-based violence can easily call and then get the services. So, and of course, camp coordination. As I have told you, there are communities that are affected by Cyclone Idai and still living in a camp setting while they are waiting to be resettled. There is that component. So we have all these sectors addressed in a way, if resource permits. So far, I think across the board, if you check our online financial tracking system, you can easily see what percentage of this 800 million has gone into responding to each and every sector, as I mentioned.
Definitely we will have you back in the studio to put our finger to the pulse and see how exactly nations are working together, galvanizing in the fight against COVID-19. But SIRAKI, thank you so much for finding time to come through.
Thank you for having me, Tawanda.
Our guest was Mr. SIRAKI Gebrehio, the United Nations Communications Specialist, as we were focusing on the role of the Family of Nations in fighting COVID-19 and finding a way out of this COVID-19 pandemic in a new normal. This has been Economic Forum. My name is Tawanda Gudlanga. It's pleasant viewing.